So welcome and thank you. My name is Des Byrne. I'm responsible for customer support at RX Mobility. Also on the webinar is Troy Connolly. Troy is responsible for PK software development. Both Troy and I will be walking you through the PK and RX Mobility integration. And I'd also like to thank Jason Wheeler, who is organizing the AV and the webinar from PCCA. So just a little bit of logistics. Because we are two speakers, there may be delays switching between the two different screens. We're both located in two different areas. And also you may find that there's two screens appearing, and if two screens do appear, then just toggle between the two of them. One will be my screen, one will be Troy's screen. And we'll tell you when to do that as we're working through this. So again, thank you very much, and let me just work through this for you. So far, smartphones, connected medical accessories and apps have sort of largely been underutilized by the healthcare industry. But that sort of changed last year in 2016. And in 2016, a shift began whereby consumers started to use more health-focused mobile apps. And healthcare started putting mobile apps into the palms of consumers, helping them drive down costs, increase access, and fulfill really the patient's, the public desire for any time, anywhere monitoring, diagnosis, and equipment. And primary care and chronic disease management primarily led the way. Clinicians are now sending patients with chronic conditions home, and they have got connected pacemakers, ECG monitors, glucose trackers, other remote sort of diagnostic equipment. And this move towards handheld medicine is occurring thanks to advances that have been made in the tools and their wireless links. These have now become ubiquitous, reliable, and very affordable. Over 80% of all Americans now have a smartphone. That means over 200 million people have a smartphone in their hands in the United States. And 80% of the time, you're actually within range of 4G LTE, which means that you can do a video call. It means it's relatively easy to conduct a video visit with a physician. It's nearly as easy as hailing a cab with a smartphone. And a lot of the data that we have been collating about mobile health adoption was done by various reports. Some have appeared in Forbes, some done by PricewaterhouseCoopers. But one of the key findings that PwC had was that healthcare businesses should start building virtual medicine into their long-term strategic plans. And a good example of how things are moving forward is Walgreens, which first launched its app in 2009. And today, Walgreens app refills one script every second via a customer's mobile devices. And in 2014, Walgreens app was the third most downloaded e-commerce app behind Amazon and Groupon. And I'll give you a sense of how many people have downloaded it. And to give you a sense of what one script every second means it corresponds to roughly 72 scripts per store per week. That's how many scripts are coming in via their app. And the Walgreens president, a guy called Alex Gourlay, he outlined the three pillars of their strategy. The first item being, and I quote, locations on the best corners in America. And the second item being the data we get from transactions. And the third pillar being through one of the most downloaded retail apps in retail. So mobile apps and mobile app technology is one of the three elements of Walgreens' growth strategy. But it just doesn't stop at Walgreens. And, pharmacy products account for 10% of Walmart's revenue and is a focus of growth. And it's primarily a focus of growth because healthcare spending continues to outpace the U.S. economy growth as a whole, and it will comprise roughly 5.8% growth annually through 2024. And Walmart believes that pharmacy, and specifically investments in pharmacy technology, will increase their revenue per square foot by 1% per annum through the next 10 years. And currently, Walmart's revenue per square foot is $446 per square foot. In March 2017, Walmart upgraded its pharmacy app. And the upgraded app allows customers to fill prescriptions via the app before they visit the store, same as RX Mobility. The company is also setting up express lanes in its stores where these customers can pick up the prescriptions And Walmart estimates that the upgrade in the express lanes will reduce the wait times for pharmacy customers to under a minute from the current 6 to 11 minutes. This upgrade could also ensure that customers use Walmart's mobile app more frequently. Walmart has executed this strategy as it believes that some customers value convenience as much as they do price savings, and that a focus on convenience to reduce wait times could draw more customers into the Walmart pharmacies. Our RX mobility technology, it enables community pharmacies to compete with chains like Walgreens. It is a Fortune 500 mobile technology platform purpose-built for independent community pharmacies and optimized for compounding. And the reason it does not cost tens or even hundreds of thousands of dollars is that lots of PCCA members are using the platform. RX mobility is really easy to use and works seamlessly with PK Compounder RX to engage patients, save time, and increase refill revenue. So what can you expect from RX mobility? Well, a mid-sized compounding pharmacy, and we've had a lot of customers, a lot of members using the app, and people who've deployed the app successfully with patients have several characteristics which we've incorporated into our training, our marketing training. But what they have experienced are 1,000 plus downloads, about 10% of script volume coming from RX mobility, that's all script volume, a 3% increase in refill revenue from RX mobility users, and a reduction in 8 minutes phone time per patient every single month. And if you've got 100 patients using RX mobility, that equates to about 800 minutes of time saved every single month. What RX mobility, so what is it and what does it comprise? The first thing that's really important is that it comprises an integration with PK Compounder. I mean, you guys run your business on the back of PK. It runs the pharmacy, it runs the lab, it runs dispensing. And so one of the key attributes of the tool is that it integrates with PK Compounder software. The second item that it comprises is a pharmacy portal. And the pharmacy portal gives you additional functionality that is not available in PK Compounder. And lastly, there's a mobile app. And the mobile app is the most obvious thing that a patient actually sees. So RX Mobility is a refill, patient engagement, and marketing tool for compounding pharmacies. It's provided exclusively to PCCA members, and it integrates with PK dispensing software. So how it works, RX Mobility automatically takes refill and other pertinent information from PK software. It uses that information to remind patients to refill a script, to report on refill compliance, and to communicate to the patient when a script has been dispensed. And it does this automatically without any intervention by the pharmacist. It just happens. It happens automatically, it happens simply, it happens in the background. Let's talk a little bit about what the app does, given that it's the most visible thing that a patient has. So the app is pharmacy branded. It takes your brand, your logo, your colors, and your name, and it's released on Apple App Store and Google Play for Android devices with your name. And that's a patient will download that app for free from those app stores. And what it comprises then are things like services, contact directions are in there, refill reminders, order my refill, order scripts, and dose reminders. They're all within the app. As well as that, you have messaging. And there's two types of messaging. There's personal script messaging, whereby you can communicate privately, one-on-one with a patient about their script. And then there's marketing messaging, where you can send messages, push messages to everybody simultaneously who's downloaded the app, thus and thereby improving your marketing efforts. The app handles multiple patients, is integrated with PK Compounder, and the whole infrastructure is HIPAA compliant. Let me just talk a little bit about integration with PK Compounder and what that means. So it sort of starts with the patient. The patient has downloaded the app. They want to do a quick refill. They enter a script number and they validate who they are by entering their date of birth. Once that's done, patient presses a button which submits the script to you, and it lands in your to-do list in PK Compounder. And once it's in your to-do list, you process it the way you normally process it. You can report on it, write reports, and Troy will talk about it in a bit. Run reports on it, and you can filter in scripts that are coming from RX Mobility or not. So you work through your to-do list, and then after typically 24, 48 hours, the cycle time for a compound, once you have produced that and at the point of validation and dispensing the item, then the script has been dispensed, then we send a message to the patient. Again, it's an automatic message that the script has been dispensed, and that goes into their cell phone, and they receive the message that the script has been dispensed. So that's all happens automatically. You don't have to do anything. These things just occur. A really neat thing, though, is that once that sequence of events occurs for the first time, and assuming that the patient has refills on their script, that information is pulled from PK Compounder, and that is populated into RX Mobility, and automatically, and let's say it's every 30 days, so automatically, after 30 days, the patient will receive a refill reminder. And that refill reminder is sent to them as a push message on their device. And again, it's automatic. You don't have to do anything. It just occurs. When the patient receives that reminder, they have one of two options. They can act on the reminder, which is great because they press a button on the app and it sends a script through to your to-do list and the cycle perpetuates. If they've ignored that reminder, then we give you a tool within the pharmacy portal to enable you to escalate further reminders with that patient. And that's a tool that's within the pharmacy portal. So I'm going to hand you over to Troy. Troy is the lead PK developer. He's going to talk through a couple of screenshots of PK and just show you where RX Mobility is highlighted in PK software. And Troy, I'll just hand it over to you. Thank you.
All right. Thank you very much for that introduction, Des. We can work on, I think I should have, all right, there we go. All right. So the question I get asked a lot is, how does this work? Essentially, the high level, you're going to have some software that we'll probably install on your server, ideally. That'll communicate back to the back end at RX Mobility, and then they handle the push out to all the mobile devices, the patient's phone numbers, and they kind of keep tabs on that all over there. So what we've done is I'm going to run through some slides here, probably real quick, and then I'll actually jump into the software and show you how it actually works.
So, Troy, if I may just say, so people who are on the webinar, there's a small window on the left-hand side. You just might increase that window so you can see it.
Yep.
Just increase the size of that window. That's Troy's screen.
Yep, and you should see the compounder in there that you're familiar with, hopefully. So, what we've done is we've added in the software a number of places, just kind of some check boxes to give you identification of particular prescriptions that are linked to RX Mobility accounts. So the script has to be linked and associated within RX Mobility before it knows. So it's initiated by the patient. They'll type in their birth date and their RX number to validate that prescription, and then that comes across into PK. We validate that that's the correct information for that patient, and then that will create that link between RX Mobility and PK. So what I've done here is, if you're looking at my screen, I've got kind of the patient prescription history here. We've got some check boxes here on the left. I'll expand this a little bit for you. So this is, again, I've got this patient here. We've got 2 prescriptions. The RX Mobility, once the patient has created that link, established that link to RX Mobility, this box will become checked, and then they'll begin getting notifications for that prescription. So I'm gonna, let's see, pop out. That's the prescription. All right, so then again, if you dive into prescription status, let's see here, my machine's a little sluggish today for some reason, but it'll pop up here in a second. But basically what we're gonna see again is that same checkbox here at the top. So up here at the top, this prescription has already been linked to RX Mobility, so that patient will get their notifications and they'll be able to submit their refill request through that. And then as well on the to-do system, So on this to-do system here, I've got 2 items for the same patient, 2 different prescriptions. It's the same drug, but this is just my test data. So you'll see one that's got the checkbox and one does not. If I go in and edit this, the RX Mobility system will add some notes into the to-do items. And it's really just, this is kind of a unique number that identifies that link. We've actually added a timestamp will be in there now as well, so you can get a little more information about when that request came across from the patient. We've also added some filters in the software to help you assist you. I know the question I get a lot is, you know, I've seen a lot of pharmacies that will call patients. They'll have someone assigned to calling patients and ask them for new refills. Well, if they've linked it to RX Mobility, there's really no need to do that because the RX Mobility system will prompt them on their mobile device. So you don't want to call and pester those patients multiple times. So what we've done on the to-do system here is we've added some filters here at the bottom. So if I run this right now, I should get my 2 prescriptions for this patient in there. Come on. And again, it's being a little slow today for some reason. So there's my two patients there. We've got the checkbox here on the right-hand side. So this one is linked to the RX Mobility, so you know you don't need to contact that patient, but if you still want to contact them for the other one, you can do that. Or we've added some filters on the grid here, so I can say do not include. And then those ones that are linked to RX Mobility just won't even show up on that report. They'll just be completely gone. So then we've also added the similar filters into the log of scripts report, and they really behave the same way. So I won't go into too much depth there, but in the filters, you've got RXs linked to RX Mobility and those that are not. And let's do this one actually for current year. And then we've also added a checkbox into the log of scripts here once that comes up, so you can see that. There we go. So, it's on. I'm sorry, it's on the detailed report. I didn't print the right report, but basically, this is just showing you the ones that are filtered out. This is the one that has not been linked to that, and you've got the notification right there that tells you it's the ones that are linked. So, and again, you can filter that on or off. The other question I get asked a lot is, how does this tie? How does the patient know when the prescription is ready for pickup? So there's a handful of ways we can do that. Generally, what we do is we tie that into the location tracking system, or you can use the RX Watch system. Both of those have what we call a completion station, and once that prescription has crossed that completion station, the notification will immediately be sent to RX Mobility, and then that patient will get a pop-up on their phone that says their prescription is ready for pickup. If you're not using either of those tracking systems, there's some videos on the website that show you how to use them, or you can tie that into the RX validation. There's an option to enable that, and then when the prescription has been scanned at any validation station, the patient will get a notification on that one. So that's all I have on my side. I'll kick it back over to Des, and he can show us a little bit about the additional features that they've added and the additional tracking capabilities they have on the back end side.
Okay, thanks, Troy. Appreciate that. One question did come in as you were talking from Justin. At what version of PK will the RX Mobility identifier show up? So Justin, I just checked when Troy was talking, and that currently the PK integration has been rolled out. Yours has not been switched on yet, and so you won't see it show up right now, but it will work from version. Troy, could you just come in and give me the exact version
yeah, it should be
that it works from?
4.11.17.3. And yeah, if you have any questions about getting updated to that version or how to activate it, just go ahead and give us a call, and one of our support representatives will be happy to call you back and walk you through the setup or the update if need be.
So Justin, I do know that the PCCA folk have you on a list, and that it is being upgraded in the immediate future, for sure. So I'll just talk a little bit about the mobile app and talk to you about how that works and show you some screenshots. So, this is an example of PWRX Pharmacy. It's a pretend compounding pharmacy, and it just shows you the branding elements of it, the logo, the colors, the images, even the app design. You get to pick those, so it's quite personalized. The app itself is very personalized towards your business. The app content obviously is, the branding and the portal that you have is obviously personalized to your business. So when the PK integration gets switched on, then a refill is entered like this. A patient has a screen that looks like this. They put in their script number and they put in a date of birth to validate who they are. And when they do that, the app talks to PK software basically, and it verifies that the script number exists, that the date of birth is valid, so it's the correct patient. And it comes back with certain example alerts. So, for example, it might say the date of birth is incorrect, or it's unable to find the script number. So there's a variety of different alerts come back into the app to tell the patient and message to the patient what the situation is. All of the alert message content is actually driven directly by PK software. So basically, it's the same message that you might see on alert on PK, and we basically pull that piece of text and communicate it to the patient via a push message. So that's how a refill is entered. A refill reminder then looks something like this. When a patient has a script on their cell phone, it looks something like this, and then the refill reminder, it gets sent automatically, and it's actually based on the day supply field in PK. That's how it's calculated. And you can see on the app itself, it has a couple of items displayed. There's a refill frequency or period, which in this case is 30 days. And just below that then in the comment section, it highlights that there's 5 refill remaining. So a patient will know how many refills are remaining. And again, all that data is driven by PK, by the patient data in PK software. So some examples of refill scenarios, no refill remaining. And so an alert at that point is sent to when the patient enters the script number and their date of birth, and it communicates to them that no refills are remaining. So that means that a new script would need to be put in place. And in one such scenario, when there's a new RX number, and if within PK you create a new script number from an old one, then the same order in RX Mobility will automatically be updated with the new script number. So that occurs automatically. Script alerts from PK are sent automatically. You don't have to do anything to communicate. Once the integration is set up, then the script alerts occur automatically. And they are a couple of main types of script alerts that come through. One is completion. And so and there's a couple of different ways of doing this. So location tracking, scan the completion station, RX wash, or the validation of the RX. And whatever way it's been set up and whatever way it's been done for you, then once you validate and dispense, then the actual a message gets sent through to the patient that the order has been completed. And equally, a rejection message will get sent through to the patient if, for example, you remove the actual script from the to-do list without filling it. And then a message goes back to the patient that it's rejected. The pharmacy portal then is something that you log onto online, and we encourage that all members of staff get login credentials because everybody can have access and everybody is tracked and traced for auditability, for auditing purposes. And the pharmacy portal also hooks up with PK software. But it does a number of different functions which are not just possible within PK software. And the analogy I'd sort of use is in the same way as you use PK Compounder to run your lab and to run your dispensing, and then you use the phone to connect with your patients. Well, then this sort of pharmacy portal is a way for you to connect with your patients without picking up the phone. It's sort of an analogy, but you can do a lot more with it. So, for example, one of the things you can do in there is you can drive marketing messages. You can send messages to everybody who's downloaded the app, and it's a really easy way to leverage the app for easy marketing. You can send messages about events, about special offers, about in-store demos that you're having, and that can all be sent simultaneously to everybody that's downloaded the app. There's a refill reminder report that gets switched on for you, and this refill reminder report, basically it's in the pharmacy portal. And if you recall a couple of minutes ago, I said that one of the real neat things about the tool is that it automatically sends a refill reminder to the patient, and that the patient can act on it or ignore the reminder. Well, if they ignore the reminder, this is the area that you get. This is the area that you get to actually escalate and to remind the patient again. So you can, from within this tool, rather than calling them, you could actually just decide that I'm going to send them another message reminder. It's manually done. It can be done at a time of your choosing with content of your choosing, or indeed you don't have to do it. Depends what way your workflow is, but that facility is there, so you can see at a glance who has sent through a refill based on the automatic reminder and who's ignored it. We then also have the ability in here to have secure script messaging to patients. So if, again, there's certain automatic features between RX Mobility and PK software, but if, for example, you want to communicate to the patient that there might have been a chemical delay, or that something else in your workflow has happened, or you want to acknowledge that it's going to take 24 hours because of the special order, then you can do that with secure RX messages. You can just go back and send a script right through to that patient automatic, and just send that from within RX Mobility from the pharmacy portal. If your workflow has new scripts in it, if you want to have new scripts, then you can have new scripts coming in. An example of that workflow is in use by various members. They don't arrive in the to-do list. The to-do list can only accept refill scripts, but RX Mobility does enable new scripts to come in. And one workflow that we've seen occur is that if patients are remote from you, but they do come over to pick up, then we find that if they're, say, 10, 15 miles away, then they can just take an image of the script, send it through to you. You can see the new script, get a heads up, and get a head start on making and manufacturing the compound. And then they can come in the next day, pick up the compound, and hand you in the original script. That's a workflow that patients a workflow that members have implemented. There's also website refills. So RX Mobility includes a website refill form that you put onto your website, and everything appears then within RX Mobility. And lastly, we send you weekly adherence reports. The number of downloads, the number of users, the number of refills, the number of new orders that are coming in, so you get an understanding of how you use this and how the metrics associated with managing the refill process. So the pharmacy portal also has a messaging capability, the marketing messaging that I mentioned, and there's also private script messaging. So these messages are all sent manually. They're not, they augment the functionality of the PK generated messages, and there's several types of messages. There's private messages to single patients about a script. It could be, communicating a delay because of a chemical didn't get in on time, or it could be communicating that the item is going to be sent out FedEx and the airway bill number is whatever the airway bill number is. The other area that we see it used a lot is in refill follow-up. So as Troy outlined earlier on, you have the PK reporting option, so you can filter out or filter in RX Mobility derived scripts. For example, any reminders that get sent out from RX Mobility, then you can actually follow up from within RX Mobility if the patient hasn't sent through a script and it's not arrived in your to-do list. This can reduce your outbound calls, and it can also change the outbound call focus so that maybe it's more focused on patients, upselling, or other activities. Areas that we've seen members using the tool, things like private messages about scripts, confirming receipt of a script, tracking numbers, delays, lead times. There are common messages that get sent about individual private scripts. So this is what the marketing portal looks like. When you log into the pharmacy portal, the marketing section looks like this. Basically, simultaneously, everybody gets sent a marketing message that's downloaded the app. You can put in a headline, for example, minus 20% promotion. You can put in text associated with the promotion, and then you can put in a button if you so desire. And the button would be, say, for example, more information. It could be a sign-up page on your website, or it could lead them to some other document related to the actual, say, the item that you're marketing. So that's really very useful for increasing brand recognition, sending out messages to help customers build a habit around the app, leveraging the app for easy marketing, and sort of giving patrons an enhanced customer experience. And that's used for that sort of tool, and it's a very, very effective tool. And studies have shown that emails largely a lot of them get ignored. It happens a lot in all industries. SMSs are used a lot, but when a push message get in right now, still it's novel enough, and it's used very effectively by businesses. And you're finding that you're getting close to 100% open rates on push messages coming into cell phones. So it's a very, very effective marketing tool. And it can be really used to add great value to the business, and it's really, really easy to use. So that's the marketing tools, messages. One of the things that we do for you is we customize marketing materials for you. There's different types of marketing materials we create. These materials are there to help you promote the app, and just the app does need to be promoted. The patient needs to know about it, your patients need to know about it, and they need to download it, so they need to understand the value proposition. And we've created a lot of different materials for you to help you communicate that the app exists and communicate the value proposition for the patient. So we have a variety of different in-store marketing materials, videos, and digital materials. And all of these items are made available to you. We also have a marketing plan that we work through with you. It's a 3-phase marketing plan. It starts off with personal engagement with patients, and as you build on the first 20, 30 users, then you focus on in-store promotion, and then you use the digital tools and focus on the digital channels to broaden the app and indeed market your business more broadly into the community at large. So again, just to finish up before we open up the floor for questions, what you can expect, and these are real numbers that are coming from members, a mid-sized compounder who has put effort and time into promoting the tool and promoting the process, then you could expect 1,000 plus downloads of the app. 1,000 plus downloads equate to 1,000 people that have downloaded your app that you can communicate to directly. You can mass market to them every single week if you want to, using the push messaging. 10% of script volume can come through from RX Mobility. Again, it's refills, but it's 10% of your scripts can come through from RX Mobility. We have been told by members that they have experienced a refill revenue increase from users who use the RX Mobility app, and you can save time and money. The estimate is 8 minutes per patient per month. So if you've got 100 patients actively using RX Mobility every month, you're talking about 800 minutes. That's significant. 800 minutes is, 12, 13 hours. It's a significant amount of time for anybody. So they're the sort of features, they're the sort of benefits that you can expect with RX Mobility. And with that, I'll open it to the floor and see if anybody's got any questions. You see any questions coming through? Troy, are there any questions that you see coming through a lot on your end?
How much does RX Mobility cost? So that's always one of the questions.
Okay, yeah. So there's it's $249 per month, and that's unlimited patients, unlimited app downloads, unlimited push messages, and unlimited pharmacy logins. And then PK software does require an upgrade, and the upgrade to the version that
4.11.17.3. Yeah.
4.11.17.3 is $1,000 to upgrade it. That's the overall. That's the cost of the tool of the program.
Yep. So, and when do the patients? I'll handle this, but when do the patients get the notification that the prescription's ready for pickup? That one. It depends on your workflow, but again, you can tie that into the location tracking system or the RX watch system. Once you've set up a completion station on those is when the patient will get notification. So ideally, that would be the last station you're going to scan that script at. It's gone through the lab, it's been made. If it's a compound, if it's gone through pharmacist validation, it's ready for pickup, and it gets scanned there, and then we'll push the message to RX Mobility, and then they'll push that down to the individual patient. The other thing is you can use the validation in the compounder as well if you're not using either of those tracking systems. So, and we have some videos on the website on those tracking systems, or if you're not using them, please feel free to give us a call, and we can kind of walk you through the process of how to set those up. And every pharmacy does it a little differently with your workflow, so it's always kind of a case-by-case basis on how we want to set that up. But we'll definitely educate you and let you make the decision on how to proceed with that if you're not using it today.
So I've got one question here about how many members are using the tool. So we've got upwards of 100 members using RX Mobility, and not all of them are integrated with PK. Most of them will be over time. The PK integration has been rolled out as we speak to members. And I have another question here about the direction that we're taking. Yeah, so it's a good question. So how we work with, the question is basically what is the, technical direction of where, how are we going to help you compete more with the likes of Walgreens and Walmart and CVS? So, yeah, I mean, what we're doing is as we get more members, we're taking their feedback. Everything they tell us, we log it, no matter what it is, every detail, everything. And we basically drive the direction from the members who purchase and use our product. Type of things that we're hearing and that we will start to incorporate. People are looking for further and deeper integration with PK. So they're looking to communicate various PK statuses because compounding, A, it's personal, but B, the lead time is 24 hours typically to make a compound. It can be longer, but it's important to actually communicate what the phase is, what the production phase is for the patient. So we're being asked to do that. Another area that we've been asked to look at is to reduce communications between patient and you guys. So we're finding a lot of members have pain with phone calls. So how can you actually eliminate phone calls out of your process? So that's another area that we're looking at another area that we will be looking at. One item that has come up more recently is video and consulting. Again, there's two different types of consulting that seem to occur. There's with the physician and there's with the patient. And that's something that is starting to creep up as a requirement. And so we may look at that. It won't be in 2017, but it would certainly be we'd look at for next year. So, I mean, the tool is really about, improving workflow in the business, improving how you engage with patients, and anything that you tell us and that we can aggregate into requirements for RX Mobility, we'll actually we'll integrate it in. Over time, we have people working on this full time, and that's their job, is to go continue to develop it. So that's the other thing I didn't say about the price point. I mean, the price point includes continuous and ongoing development. It's not just an app and we walk away from it. It's not just a tool and we can walk away. We continue to invest R&D dollars into this every single day, so it becomes a really excellent product for your business. So I had another question here. Is this a contract, or can this be stopped any time without any extra fees? So yeah, we don't have a contract. We don't ask anyone for a minimum contract. We just ask for 30 days notice. We do ask that you give it a fair shot, because a lot of effort on our part up front, and we ask that you and I think it's good for your business that you market the app, because ultimately it's about marketing and growing your business, and that you give it a fair shot. But we don't. If you want to pull out of it, there's no cancellation fees, there's no cancellation time. 30 days notice. That's it. So thank you for that question. Can the patient enter a message to the pharmacy when entering a refill? So yeah, they can. Let me just scroll back up on the screen. I'll see if I can get here. So the patient can actually edit this particular. I've just brought it up on the screen, if you can see that. The patient can actually edit details on this particular screen. So when they have a refill, a refill reminder comes in, the sequence is that the refill reminder push message comes into their device, same way as, say, Facebook or any other app that you have. So it comes in, they press on that refill reminder alert. It actually opens up the app, or it asks them, do they want to open up the app? If the patient says yes, it brings them through to that relevant alert. The patient presses that, it brings them through to the relevant script, and this is the relevant script page. So they can actually modify the details of that script, and they can make changes when entering that refill. So I hope that's answered your question.
And then, well, I'll just follow up with that on the compounder side. That those notes that the patient enters will come into the notes in the to-do system. So if you look at the to-do system, you'll see the notes in there that came across from the patient. So you will see those.
Okay. So that means, Troy, that the items, that any notes that come in into Rx Mobility, and they all get synchronized in the PK compounder, so everything that the patient sort of effectively tells them, the pharmacist, is visible to them.
Correct.
Okay. Cool. Is there any other questions from anyone else? Anything else you'd like to find out about it? I don't see any other questions come in, but Troy, do you have anything else you'd like to add?
I'm not seeing any at this time, but if you do have questions in the future, please reach out to us, give us a call, email us, and we'll be happy to follow up with you on that at any time.
Okay. Yes, thank you, Troy. Yeah. If you have any other questions, just email me. I'm des@rxmobilityapp.com, and Troy, T.Connolly at PCCARX.com, either or, and we'll do our best to get back to you. Yeah. So then, no more questions then. Thank you very much. We will post a webinar on our website. I will also email everybody a copy of the script of the actual presentation as well after this, sometime in the next couple of days. And thank you very much for your time. It is much appreciated. Thank you.
Thank you.
Bye-bye.
Bye-bye.